Well, how many? 7? Good afternoon, everyone. Thanks for joining us. We are live in the Dutchess County Legislature and the legislative chambers, and we thought today we would do our update here with all of you. Since we are here, I'm joined by the chairman of the Dutchess County Legislature, Greg Pulver.
Welcome.
Thank you. I appreciate it. That's actually his seat, and this is the clerk of the legislature sits in this seat, right?
But we'll let you use it today.
I appreciate that. So we want to get through some updated information. Greg, you are how many years chairman now?
This is my 4th year as chairman.
And you represent?
The 19th district, which is all of Pine Plains, Milan, Northeast, and Stanford, the largest geographical district in Dutchess County.
That's true. And Greg and I have served together since 90.
Yeah.
When did you start as?
It was school board was 96, so in that neighborhood. And then 2000 as supervisor.
Greg was supervisor of the town of Pine Plains when I was still mayor of Tivoli and a member of the county legislature. In fact, I represented for a brief period of time the town of Milan in my district before we downsized in 2000 and something, and my district became all of Red Hook, and the district you have secured.
Grabbed Milan.
Yeah, we shifted around a little bit. We're going to have legislator Mike Polashek here in a moment. We're going to talk a little bit about some ongoing activities. So, Greg, what I'm going to do is just go through some of these data points. As if you have a question, and I'm sure you must have been waiting, we apologize, please write it in the comment section below the live stream, and we'll try to get to as many as we can this afternoon. Let's start, if you would, just by going over some of our data. Everything has trended in the right direction. It's a result of vaccinations and good weather. I mean, the truth of the matter is people being outside more has slowed the transmission, and the rate of vaccinations has slowed the transmission of the virus significantly. We are now monitoring 301 active cases. I would guess, if I'm betting before the end of the week, it'll be under 300. Remember, over the weekend we get cases in, but because it's a weekend, we're not able to verify all of those. So sometimes the numbers go up over the weekend, only to drastically come down on Mondays and Tuesdays. So I suspect that we will be at about just under 200 active cases by the end of the week. But 301 active cases, 12 hospitalizations, certainly a concern, but very low. And the positivity rate has come down to 1.25%. That is the 7-day rolling average. Now, just as a reference, today we're at 301 active cases. 2 weeks ago, we were at 521 active cases, and at our peak, 2,576 active coronavirus COVID-19 cases. 12 hospitalizations today, 31 hospitalizations 2 weeks ago, and 172 at our peak in January. Jumping to vaccine and vaccinations, we have seen a continued increase in total vaccinations. Today, 152,000 Dutchess County residents have begun their vaccination series. That represents 52%, 51.7% of Dutchess County residents have begun their series. That's 62% of all those 18 years of age and older. 128,000 residents have completed their vaccine series. That's 44% of our population, 43.8% of our population have completed their vaccine series. And for the record, if 151,000 have begun, it is expected over the course of 3 and 4 weeks that completion rate will jump. Now, because of the use of the Johnson & Johnson vaccines, we have fewer and fewer who are taking the 2-dose option instead taking the single-dose option. So what that means is at some point soon, those who have completed the vaccine series will come very close to those who have begun it, and there's only going to be a smaller division distance between the two. Today, a lot of changes in the state of New York. Some of them are a bit misleading, so let's get to all of them. So May 19th, many changes have gone into effect. Noticeably, number one, today in the state of New York, if you're fully vaccinated,
no mask.
No mask.
No mask.
So Greg and I are both vaccinated, and there is no expectation that you would wear a mask, or no expectation that there's a need for social distancing amongst ourselves. Now, there are still settings where masks by the CDC and the state of New York are required. That's on public transit. That's in healthcare facilities. Still in schools, although I will tell you that I do not believe that there is a need to have students masked in a school classroom setting. The reason that we know this is because we've monitored cases in daycare and childcare settings, right, and those are certainly not masked in most instances. But also we know that transmission rates in schools have been very, very low. However, state of New York and CDC still says in a school setting one wears a mask. Nursing homes, homeless shelters, and still in correctional facilities. But other than that, if you are fully vaccinated in the state of New York, after pushing the governor, this state has joined most of the others in America in identifying that no masks are necessary if you've been fully vaccinated. Now, what the CDC says, Greg, and I think it's important to remind people because there are some who obviously still have some concern. Right. What the CDC has said is that if you are fully vaccinated, you are unlikely to contract the virus. Now, could you test negative? You can. For instance, the Yankees. Right. Right. Can you test negative? You can. But that, keep in mind, is if you're being tested every day, it is possible that you could be carrying the virus in your, as Dr. Wythen would remind us, your nasal passage. Yes, right. So it's possible to test it, and it's possible to see it. But if you don't have any symptoms, right. So the position of the CDC, Dr. Fauci had reaffirmed this over the weekend, which I was surprised because he's been on his messaging has changed a little. But what they said over the weekend, and this is the CDC's confirmation that this is backed by science, is right, if you are vaccinated, you are not only unlikely to contract the virus, you are less likely to transmit the virus. So if you are vaccinated, you are not the one at risk. If you are not vaccinated, you still have the risk of contracting the virus. So if you have a concern, if you're a vaccinated individual and you have a concern, there is a significantly lower risk of contracting the virus and certainly giving it to somebody else. We know that. There were some folks who have asked, well, my children aren't yet vaccinated, and so what about them? This is all a matter of choice. At this point, and so we're at a point now where in the response to this crisis, and it's it's like any other emergency. In the early phases of an emergency, you clamp down, right, and then over a period of time. And
we've learned so much more about this disease over the the course of the year that we've been through this. That we're finally getting some good data and listening to science, which is what we're supposed to do.
Yeah, and the CDC has made clear that the science is that again, if you're vaccinated, masks are not necessary. So we've implemented that countywide. Of course, the county government has no say. This is all up to the state of New York, but we did push and we have embraced this change. Now. There are other changes that are underway here in the state of New York. The state says beaches and pools can operate with some social distancing, but basically you could be full capacity with distancing, but the expectation is by July 4th, beaches and pools would be at 100% capacity. Indoor social gatherings, now up to 250 people. Outdoor residential gatherings, there is no limit as of today. So, Greg, you can have a few hundred people in your backyard.
That's what we're looking forward to.
I know, your wife wants that.
Yes.
Indoor residential gatherings, 10 to 50. Now, you can have 50 people at your house. My wife is not having 50 people at her house, but that's now, that has been lifted. Large-scale indoor events, there's some capacity limitations still, but again, most of that now, we're at 30% indoors. 12 a.m. food and beverage curfew has been lifted. Outdoor dining in Dutchess County continues. We've waived the local restrictions on outdoor dining. There's a curfew on catered events that's lifted if you can confirm vaccination or that's being lifted on May the 30th. So the 1 a.m. curfew for catered events is being lifted on May 30th. And large-scale outdoor events, including professional and collegiate sports, live arts events, etc. There is no limitation so long as you can either meet the fully vaccinated standard or, however, just meet the basic physical distancing. So if you have a large field, you can have as many people as can fit with some distancing. Okay. So a couple questions. I'll answer, and you can jump in if you want to.
Okay. Thank you.
Any talk of vaccines being mandated as more groups are authorized. Any talk of vaccines being mandated for schools. The governor has said it is not his intention to do that, and I do not support mandatory vaccinations for COVID-19.
Right.
I do think that encouraging people to make the choice best for them makes sense. Do you have
I
an opinion?
agree. No, I agree.
So we have not heard of any action to mandate in schools. When will DMV be more open? You shouldn't have to wait weeks to register your car. Okay, so a couple things. The Department of Motor Vehicles is a New York State department administered by the independently elected county clerk. So number one, Dutchess County Clerk Brad Kendall has taken a number of steps to try to be as accessible. Right. Registration, re-register, if you have to re-register in those activities, you can do a lot of that online or through the drop boxes, but the state of New York has not permitted the DMVs to open to full capacity, not before June 1st. So the standing order prohibiting DMVs from opening stands until June the 1st. How's that?
Correct.
When can businesses start lifting masks? Today. If you are a business, only those that have been identified are mandated to have mask use. There is no requirement that businesses maintain a mask policy for those who identify themselves as being vaccinated. So there's a question, right? The state of New York says that a business can mandate masks still. They don't have to. My recommendation to businesses is they follow the CDC guidance. It will reduce stress, it will reduce confusion, and it will eliminate moments of conflict where somebody demands why you're not following. My recommendation, and it is my recommendation, is not, I'm not making, I didn't ask someone else, so do what you think is best, but a business, I think, should follow the CDC standard. The second question is, well, how do we trust people? There is not a mandate that an individual shows that they've been vaccinated. There are a couple things and then let's jump to some issues that I know that you wanted to talk about as well. There are a couple things. As I was saying before, if there's a major emergency, we clamp down. We take immediate action to centralize decision making, to limit certain access. If there's a fire in a building, right, you close down the neighborhood. In the village of Tivoli, when you have a fire, you close down a block. And then as you control that fire, you start to let the traffic flow. The fire department stays at that fire until even the last bit of smoke is out, but we don't prohibit people from walking by or walking near it. We have transitioned from a serious state of emergency where we needed to make certain important decisions to the point now where we need to trust people and accept that people will either be honest or dishonest, and that we all have to assume a level of risk. That's where we are now. And so the state of emergency from a government perspective is over. However, the governor and the state still have a declared state of emergency. So I want to be clear. From an emergency response perspective, we're not in a state of emergency. We still have the government, however, imposing these standards. So in the case of what we do in life, just like anything else, we are going to have to assume a certain degree of risk. But we do know this. We know that based on cases and based on positivity rate, the level of risk has now subsided to a point where it is much lower, and it is safer for us to make individual choices and accept that some people are going to lie about it.
And if some people want to continue to wear a mask on their own, they should be able to do that, and they should not be belittled for wearing a mask, and people should not be belittled for not wearing a mask. We should respect one another and
I agree.
Deal with that.
And so another question, do children who are not yet vaccinated need to wear masks at summer camp? The state just issued today overnight summer camp guidance. We have not yet digested it, but generally speaking, children who are not yet vaccinated, actually all children, in a daycare or camp setting are not mandated to wear masks. There are certain settings where in a day camp, prior to today, mask wearing was mandated. I don't know if the state eliminated those moments. But what I want to be clear about is that just as in a daycare, there is not a mandate that children wear masks at summer camp. And our recommendation is the same that we had for, this is through the health department, the same we had for daytime athletics. If you're actively engaged in the activity, you're not wearing a mask. We don't mandate that to happen at a little league or a soccer field. That is not required. And so for activities at camp, wearing a mask as a child is not mandatory. If the organization wishes to have that policy, they do currently have that right, And there are certain instances where, maybe it's in like a theater setting or in a cafeteria setting where the state still requires a mask wearing. But today, the state issued some new guidance on camps, and I don't have an update of that. We wanted to jump before we have Mike join us. There's a lot of activity going on in Dutchess County.
Yes, there is.
One of the things that people should pay attention to is road construction. We're doing a lot of it. We're catching up.
Yeah, we're catching up after last year, yes.
And so we have a number of projects underway, both administered by the Department of Public Works and then others that vendors are doing. We're going to talk to Mike, but we have Titusville, Knoxon Road, Old Route 22 in Dover, Huns Lake Road, Clinton Corners, the Shunpike, major work on drainage at Old Hopewell Road and Beekman Road. Those are big projects.
Right.
And
I visited the Huns Lake project last week.
You did?
Yeah.
How's it going?
They did a nice job. I mean, we have a talented crew of people, and it's nice to see money hit the streets,
so to speak. So it's a lot underway, and what I want to do is, if you don't mind, let's invite Mike Polashik up. Let's talk a little bit about his neck of the woods, and then we'll have you come back and we'll do some more questions. If you have questions, write them down.
Fair enough.
Do you chair anything yet?
Not yet.
No. So it's your first time in that chair.
Yes, sir.
So Mike Polashik is a county legislator representing the town of LaGrange and...
No, just the town of LaGrange.
Okay.
Just about 2/3 of LaGrange.
And so that's District what?
3.
But this is good because we have a business person question. You are also a business owner.
I am.
Why don't you tell us your business without advertising it?
Simply Gourmet Catering. We're on Route 55 in LaGrange.
Are you? So how many years have you been a small business owner?
13 and a half years.
Not bad. Feeding people.
Yeah, it was tough last year, but we're getting back to events. Well, as you were saying, events are opening back up again. It's good to have people together.
Yeah, so businesses like yours were particularly hit because, listen, restaurants were hurt, but restaurants could convert to some degree, take out and drive.
Yep.
And so I know, so I know a lot of restaurants that scaled back their workforce, of course, but still somehow were able to make it work simply because they were just doing curbside and takeout with just a core staff, maybe the owner and one or two. But businesses like yours that rely on catering events.
Yeah, when they put a limit on how many people can get together,
Yeah.
it's not easy to run a catering business.
Yeah.
So it was tough, and for folks like myself, we had to pivot. We became takeout restaurants for a little while.
Sure.
But it got us through and kept staff working, and that's always the most important thing. Yeah. Keep people working. You know what I mean? And they have bills to pay, they have lives, children to feed, and so that's what we did. But it was definitely tougher than a restaurant. I'll be honest.
Yeah, I can only imagine. Obviously, but we've been dealing with so many businesses. Whether we try to assist through the PPP, some qualified, some didn't. And you know this, the county, Think Dutchess Alliance has launched a sort of a small business assistance program where we're trying to do some micro marketing for small businesses to help kind of get their message out. And we are seeing growth. Admittedly, there are businesses that may never open their doors again, and that is very unfortunate. And we've talked about this a few times at the town hall meetings. Owning a business isn't only about owning a business. For some people, and I'm sure for yourself, this is like a lifelong dream. It's sort of the American dream, right? I've opened my business, I'm employing people, I'm making a difference, and to have that shuttered isn't only about losing money.
Right. You're right. 13 and a half years on my own in business, you don't go into business without having that passion for wanting to do it. And like you said, about employing people, but also just being able to give back to the community. And that's been another hard thing that's really happened this past year is that especially our local business owners, they're the backbone of our nonprofit organizations. And we enjoy that very much, giving back. And having this year, just business being decimated for some of us, we lost that ability to give back. So we had to figure out other ways to give back. It may not have been monetarily, but it may have been from volunteering and helping in other ways. But that sense of pride you have is kind of ripped away temporarily. Because you just don't have the ability to do what you did in the past. But
agreed. 70% of new jobs come from existing small businesses. I'm guessing that's going to be a little bit higher under the current circumstances. Are you? How many employees do you have, generally speaking, from time? Whether it's vendor or not?
In a busy season, we have about 25.
And so, are you hiring now? Or?
Oh, we are definitely hiring now. It's been a challenge.
What's the experience on hiring?
Very challenging.
Yeah.
There is. You can put out ads. You can put out ads paying more money than you've ever paid, and get no responses. And frankly, it's the unemployment benefits has been hurting us, but it's a challenge. We're very, very fortunate as local small business owners that things are opening back up, and we have the support of our communities. But when we can't do the work, because we just literally don't have the people, it's been challenging.
Yeah,
very challenging.
I think too many in government don't quite understand
No.
that. So this person asked, as a business owner, how do I know if someone is vaccinated? Is it against HIPAA regulations to ask? So here's the thing. What the state of New York has said is that one can ask an event, you can ask to show your vaccine pass or your Excelsior pass. My suggestion is you don't.
Right.
And I mean that sincerely. I think you create too many fault lines where there's going to be problems. But the state does say, and this is why it gets confusing, the state of New York says that we know what the CDC guidance is. If you still, as a business owner, wish to have a mask requirement, you can do that. And that you can ask for proof of vaccination. We did this once before. Early on, it was if you had some health condition or someone and you weren't medically able to wear a mask, we couldn't ask you to wear one. And I was asked many times, can I ask? You can ask, but the individual is under no obligation to tell you anything. And then what? So at the end of the day, you really are taking the individual at their word, and that's honestly the moment we're in. I don't know how to explain it any better. If as a business owner you want to create that fault line, you can do it, but it's going to create conflicts, and you are going to have issues. The best answer is to say to people wearing a mask, if advertise the CDC requirements. If you're vaccinated, you don't need a mask. By entering this building, you acknowledge that you've met the CDC requirement. And then, and again, there are those who are at home saying, "Yeah, but if they're not wearing a mask, they're putting people." Yes, they are putting somebody at risk. But we know based on the data, both the science that we know about the virus and the results in the data we have, positivity rate and total number of cases coming down, that the level of risk is significantly less today than it was 6, 7, 8 months ago, or even, by the way, 2 months ago. And again, it's one thing in the heat of an emergency, right, to clamp things down. But as you exit that emergency, you've got to go back to a situation where we just accept that some people are not going to be honest, and that we all have a choice to make. I leave this building. When I walk across the street, most of the time, I choose to walk in the crosswalk because I know in that crosswalk someone is likely to know I'm there. But sometimes I walk right across the street. Now that's probably jaywalking, but I'm not sure if it's illegal in the city of Poughkeepsie. Next time an officer sees me, they may want to stop me. But that's a risk I take. Now this is a little different because again it's a virus. But we're at a point now where but I just think you're better off following your the CDC guidance and leaving it at that.
And that's what we're doing as a business. That's what we're doing as a business. I encourage other businesses to do is that, the guidance came out from the CDC. It's been adopted by the state of New York. Frankly, the conversations we've had at work is, do we really want to start asking everybody and have them get mad at us? You know what I mean? If the guidance is there and the science is there that this is okay to start doing, then let's start doing it. What we are flooded with questions from our clients today asking, I heard about this, And we told our clients, if you have guests that want to come to an event and want to wear their mask for their own personal safety and protection, that's fine.
Yeah.
No problem. Like Greg said before, we're not going to shame them. We're not going to ridicule them for doing so, and that's their choice.
Yeah.
Some clients are choosing to reach out to their guests and say, listen, we really like you to be vaccinated, but as a business, we're not going to prohibit anyone to entering if they tell us that they're vaccinated and they don't have a mask on.
Yeah. So this question, is it legal for businesses to ask employees if they've been vaccinated? The short answer is yes, but it's not that easy.
Yeah.
So an employer should consult whoever does their HR work.
Yeah.
And the reason I say that, and some businesses saying, well, I don't have anybody who does that, then you probably shouldn't poke
You're right.
and the reason is because not anybody can, right? So in my case, the HR department could ask people if they've been vaccinated, and the employer can mandate in the state of New York that the individual be vaccinated. Neither of these things is a good idea because it just opens a can of worms that you're never going to be able to get at. So in the case of Dutchess County government, for instance, we could ask employees whether or not they've been vaccinated. And when I say we, that is the Department of Human Resources and their department head. That is not the supervisor that they report to. That is not the team that they work on. And so if you create an environment where everyone is asking those questions, you can ultimately infringe on someone's privacy.
Exactly.
And that opens you up to...
It's a fine line.
It is. So our position is, and I say this just because it's just the safest thing to do, is to say to your employees, if you're adopting the CDC guidance, Now, you've decided that you're not going to require employees to wear masks if they've been vaccinated. You should say to your employees that it is now incumbent upon you to live by this standard.
Right.
And by the way, there's a way to find out sooner or later.
Yeah.
So the basis should be for an employee. This is my advice. It's not no one's giving. I'm not reading from a handbook. Is to simply say, by not wearing a mask, you are affirming that you've met the CDC guidance. Then you're as safe as than you are. Can employers require employees to wear a mask no matter what? Currently in the state of New York, yes. Currently the state of New York says, and this is why it's confusing, the governor said he adopted the CDC guidance, but still allows a business to require a mask if they wish. My suggestion is that you live by the CDC guidance. It is the safest from a legal perspective.
Absolutely,
And that's what you're doing.
I completely agree. You know, we have an HR outsource our HR. We talk to them. We've consulted other business agencies and trying to figure out what's the best way to go about this. And that seems to be the consensus: is that this guidance is there for a reason. It's based on the science. And as a business owner, you're much better off just following the guidance than to try to write anything on your own or try to prohibit people and make people. People can get angry if you don't.
I think you just want to minimize the number of
Yep.
fault lines.
Yep.
So, Mike, we are repaving County Route 49 and County Route 21. I know we're repaving 21 because I just drove over it. But these are both in LaGrange. Any complaints yet?
No.
Oh, good.
I had the opportunity. They were doing Knoxtown Road yesterday, about a mile, and doing an overlay there. The opportunity to visit the crew out there, and Gary Cooper, who's the highway director, just to learn a little bit about it. And it's great to see. I believe in government, investing in infrastructure, and it's nice to see it in LaGrange.
So you were asking me on the way in, and I'll just tell you now, the question about what about federal funds for infrastructure. So the first batch of dollars we received through the American Relief Plan, American Rescue Plan, doesn't specifically include dollars for streets, sidewalks, and highways. There is some water and sewer money, and we'll be talking about that. And I know that this is important to you. We'll be talking about that next meeting. Okay, but the federal government is apparently considering a large-scale infrastructure funding. Now, I'm hopeful that they stay focused on infrastructure. I think when you add more to it, it becomes maybe easier to pass because you get more people to buy in. But I think that we have an infrastructure problem in America, in particular in the Northeast, and focused on streets, sidewalks, highways, and bridges is a good focus. I'm sure you have an opinion.
I absolutely agree. Our roads, bridges. I mean, people use them every day, and as an elected official, people pay taxes, right? And that's something that they can see every day, right? The snow plowing is a perfect example. Yeah. They expect that their roads get cleared during the winter and do it well because they pay taxes. That's their right. They feel. But besides that, roads, bridges. It's just important. It's how we commute to work. Granted, some people may not be commuting as much as they used to, but it's how we commute to work, it's how we get places, and it's important that for our own safety that they're well maintained.
Yeah, and we have a great highway department that does some of that work, and of course we contract with others. Old Hopewell and Beekman roads, these are very large-scale projects that never go exactly the way we want them to go. We usually find, and these come to us from some federal funding, previous federal funding, and what we end up finding on these larger roadways is the infrastructure beneath. Even though we analyze and we survey and we do the engineering work, we rarely uncover what we think we're going to uncover. So there's always more construction that becomes a little bit necessary. But much of the drainage work has been installed on Old Hopewell and Beekman. They're working on some paving on both. Next, reconstruction of Old Hopewell Road and All Angels at that intersection. That's underway now. They're installing a new traffic signal later this year. And it will take us through spring of next year to complete all of the Old Hopewell Road project. Beekman Road, again, some drainage work already underway, already completed. Paving underway through summer of this year. New signage, etc. That'll be done through the fall of this year. And in particular, in the case of Beekman Road, we're doing a lot of that work in coordination with the town of East Fishkill. In fact, there's a project at Beekman Road and Phillips Road. So I know that's not your district, but still a lot of construction.
If I could just emphasize too, construction it can get frustrating as someone driving on the roads. Be patient. I mean, these crews are out there on some of these roads that are pretty busy, and we want to make sure that they stay safe. So I noticed a couple of folks yesterday when I was walking down Knox on asking how long this is going to take. We seem to be in a hurry to get to nowhere sometimes, but just be patient. It's the time of year where paving and road maintenance and culvert maintenance is being done. So I just ask everyone, be aware. Don't be on your cell phone when driving through a work zone. Be patient. Go slow, because these are lives out there doing the work, and we want to make sure we ensure their safety. Agreed.
We joke if there was some way to do road construction without interrupting people's lives, we would do it, but sadly we don't. So anything else you wanted to cover?
No.
Anything exciting going on in LaGrange you want to mention?
LaGrange is a beautiful place. We have a lot of great parks, so come visit us.
Fair enough. Mike, thank you very much.
Thank you. I appreciate you having me.
Yeah, thanks for being here. We're going to get Greg to come on back as he does. Let's talk a little bit about our vaccine clinics. We have transitioned from the traditional two large clinics that we've done at JCPenney's and CVS in Dover to a much more strategic approach now. We're at the point where we have to have much smaller, more strategic locations. You've been to a couple of our pop-ups. What do you think?
I think they're great. People seem to, I don't want to say enjoy going there, but they appreciate it. 20, 30 people at some of these events, and as you said, that's the outreach. Those are the local people that don't want to drive to JCPenney or to Dover.
So, or can't. They're coming off the road. Right. They're working on a landscaping project.
They have a half an hour to eat lunch, and they decide to get a vaccine instead. Yeah. And it's working. Yeah. It's working.
It is, and we're getting strategically to a number of locations. So this week, we are at JCPenney's. That's open and functioning. We had a pop-up clinic today in Pauling. On the 25th, next Tuesday, we are at the Mexican consulate in the city of Poughkeepsie. Bet you didn't know we had a Mexican consulate. I knew that. We're visiting? He's visiting. He's visiting with us. He's visiting, and we're doing it there. The Mexican consulate is visiting. I thought we were going to a building. So we have a clinic there in the city of Poughkeepsie. We are at the Weebatuck High School in Amenia on Tuesday. That's your neck of the woods.
That is my neck of the woods.
On Wednesday next week, we're at Dutchess Community College in Poughkeepsie. On Thursday, again in partnership with the Mexican Consulate in the city of Poughkeepsie. On Thursday, we are at the New Hope Community Center in the city of Poughkeepsie. We have a handful of partner pop-up clinics that are underway. You ready for this one? We have the Mid-Hudson Regional Hospital is today. Wappingers Junior High is today. Mid-Hudson Regional on Thursday. The Beekman Pharmacy on Thursday. Faye Garrido wanted more access in Beekman, the town supervisor. Beekman Pharmacy access on Thursday. Mid-Hudson Regional Hospital access on Friday. On Sunday, the 23rd, we're at Stissing Mountain High School. Yep. I think on the 23rd, we're also at the Red Hook High School, I feel, with the apothecary. Did I get that right? Apothecary. Yes. Yeah. What is it called? The Village Apothecary. Thank you. I always get that word. I've stumbled over it every time I say it. In Red Hook, but anyway, on the 23rd, we're at Stissing Mountain, and again on the 23rd, pop-up clinic in Beekman. We're doing a little bit of work, I think this weekend in Wappinger at their craft fair. We're going to be at the town of Wappinger. Thank you, Dick Thurston, supervisor of the town of Wappinger. We're doing a clinic with some information and some shots in Wappinger. Also then, with a partner, we're going to be doing some homebound visits in Wappinger on Saturday as well. So a lot going on. We also are getting ready for Memorial Day and Memorial Day weekend. Is Pine Plains doing their...
Pine Plains
What is the Pine... I love the Pine Plains Memorial Day.
Yeah, so
it's early morning.
It is. It's 10:30.
Oh, it's not?
Yeah, so it's Stanfordville's at 9.
Okay.
I start at the town of Northeast at 6 a.m.
That's the one. Yeah,
6 a.m. It's a beautiful... We do 7 cemeteries in the morning and pay our respects. And then the Stanford at 9, Pine Plains at 10:30. Day before is Milan at noon.
Oh, is it?
Yeah.
I got to add that one to my calendar. Milan at noon on Sunday. Yep. So we're doing. So there's the Walkway Ceremony where we change we retire a flag at the memorial at the walkway over the Hudson at 8 p.m. on Sunday, May 30th. We'll be doing that in a partnership with the Walkway over the Hudson, and County Executive Pat Ryan and I both will participate as sort of a bridging, if you will, metaphorically and physically, of the two counties. The county itself is hosting our Memorial Day ceremony at 11 a.m. on Monday, of course, Memorial Day, at the county's War Memorial. We are also hosting our countywide convoy, 2 convoys. So at 9 a.m., leaving the War Memorial in Poughkeepsie, we'll be traversing sort of the inner loop of Dutchess County. And then after the ceremony at 11:30 a.m. from the county's War Memorial in the city of Poughkeepsie, or town of Poughkeepsie, we will be then going on a convoy in the outer loop of the county. And that is a pretty extensive amount of work to recognize, of course, those lives lost in service to this country. So a lot going on. It's a solemn holiday. It is also nice to get back to something that resembles, normal. And I know the both of us will be in a number of events.
Oh, yes.
Yeah, you a little bit earlier than me.
Well, yeah.
Although I might convince myself to come to Millerton.
I tell you, that 6 a.m. ceremony is great. I mean, you've been out there with me before.
I was 2 years ago.
2 years, that's right.
It was great. It was so special. They started in the village of Millerton, and then from cemetery to cemetery they raise a. But it's very special. It's really nice and beautiful. It's just as beautiful.
It is.
So maybe I'll try it again.
Yeah.
Maybe I'll convince a child to come with me.
There you go.
Like one wants to wake up at 6 o'clock in the morning. If you have any questions, write them down in the section below the live stream. We're going to get to a couple more. If shots are free, why do we have to provide insurance information? When you come to a Dutchess County clinic, are we asking for insurance information? We don't. So at the Dutchess County clinics, we don't. However, if you're going to another location, if you have insurance, the reason that they ask that is a couple things. Most notably, the provider might get reimbursed cost, so you don't have to pay anything, but your insurance company may have paid something to the provider. The second reason they do that is the provider themselves, when they code a particular item, may qualify for federal reimbursement. So vaccinations, the reason they're free is because the federal government and the state government put money in the pot to cover those costs. Now, a government like ours, we don't recover any expense through that. We just get the money directly from the federal government. But if you're an insurance provider or you're a pharmacy or a doctor's office, you may qualify to get some of that federal aid. And the way that you do that is to, in essence, code the insurance, build the insurance company who either gets the money to recover the cost or you get the money to recover the cost. So that's why they ask for that information. How'd you like that?
That was a good answer.
Good, I tried. Did I get it right? No. We are next week broadcasting our town hall meeting at 4 p.m. So we'll be 4 p.m. change in time next Wednesday. We'll be from the VFW in the town of Poughkeepsie, post 170, 4 p.m. in the town of Poughkeepsie. Be joined by Adam Roach. Adam is the Director of Veteran Services, as you know, for the county. We'll talk a little bit more about Memorial Day services and services for those men and women who have served our country. If there aren't any additional questions, Greg, did you have anything else you wanted to?
I think I'm looking forward. We had bingo in Stanfordville yesterday.
We did.
And that was fun. Drive-through bingo, and then looking forward to the senior picnics as they start coming through.
So picnics return next week on May 26th. We'll be at Boyce Park in Wingdale, town of Dover. And that will begin our picnic schedule. So the first ones are drive-through. At some point, though, we will convert back to in-person picnics, and that'll be sometime. Will you sing when we go back to? Only if you demand it. Yeah, we'll hope so. So we hopefully, the Office for the Aging expects to convert back to in-person picnics sometime this summer. So hopefully we'll have a couple that are back in person. Let's end with, because I know you feel I feel this is as important as I do. May 16th to 22nd is National EMS Week. This is the moment that we recognize those men and women in both volunteer and career paths of emergency medical services, and Dutchess County benefits greatly, in particular from our volunteer corps.
Absolutely.
Did you drive ambulance for that?
I just recently found my Dutchess Community College receipt from my very first EMT course back in 1986.
Wow.
I paid $60 to become an EMT. I did it for 9 years. I was captain of the rescue squad for those, and then I transitioned into the National Ski Patrol.
And you use the same, I mean, it's the same skill, same training in that case, yeah. And so We just have a tremendous number of emergency medical service corps, both private and public, rely heavily on volunteers. Very grateful to all of them. I'm a 15-year active member and a 25-year associate member of the Tivoli Fire Company, and that I was both while I was active. I'm no longer active. I'm now 10 years as an associate. But I used to tell the story that so I never ran into burning buildings, as you know. I was fire police and exterior. But I also drove the ambulance. The only problem was I can't back up the ambulance. So as long as we went forward, it wasn't a problem. Which generally meant that the only thing I couldn't do was park it and back into the
Well, that's
fire.
good that you're steering the ship of county government forward all
Forward
the time.
all the time. We never back up.
Never back up.
So with that, we're going to wrap up. If you have additional questions that we didn't get to, please feel free to reach out to us throughout the rest of the week. Try to get you additional information. A lot changed today with the mask mandate being lifted in the state of New York. Follow those CDC guidances. Changes in a lot of the restrictions that the state has in place. All positive steps, and the good news is the data and the results are there. We're seeing a precipitous decline in the positivity rate, a decline in active cases, and people are staying healthier, and that is what is important. So,
Absolutely.
anything else?
Nope, I'm good. Thank you for
Okay.
joining us, or having me join you.
Thank you for having
the
us in your
chambers.
chambers. And ladies and gentlemen, we'll see you next week from the VFW, Post 170 in the town of Poughkeepsie. In the meantime, stay safe, stay strong, and be kind to each other.